Endoscopic removal of lumen-apposing metal stents, risk factors for stent embedment, complex removals, and adverse events. Analysis from a multicenter prospective case series. Introduction. Lumen-apposing metal stents, LAMS, are being increasingly used to treat pancreatic fluid collections. LAMS are also temporarily deployed to drain other intra-abdominal fluid collections or to create temporary access to the duodenum and the biliary tree after Roux-en-Y gastric bypass surgery. All these indications, along with others, usually require the removal of the stent at the end of the treatment. While there are many published papers assessing LAMS-related adverse events, data regarding the safety of their removal are scarce and mainly retrospective. A retrospective single-center study, including 104 stent retrievals, reported an 8.7% adverse events rate, all of which were moderate or mild events. Another retrospective multicenter study involving 93 stent retrievals reported a 5.4% retrieval-related adverse events rate, with 2 severe adverse events, a hemorrhage treated by embolization and a perforation that required surgical treatment. Follow-up after LAMS placement is not always easy. They are usually deployed in advanced endoscopy units, but follow-up is often performed at the referring institutions. This entails 2 complex situations. First, removal might be attempted at institutions where advanced endoscopic procedures, which might be required, are not available. Second, follow-up techniques such as necrosectomy, secondary procedures, or, more importantly, stent removal itself might be delayed, as conventional care pathways between attending physicians and out-of-center endoscopists are frequently lacking. In this situation, severe delayed bleeding, embedment, or other complications may occur, as these have been associated with longer indwell times. These situations might also complicate removal of the stent. The authors therefore aimed specifically to assess the safety and feasibility of LAMS removal. Additionally, the authors evaluated the risk factors for complex removal, which could be of use in identifying those patients who should be referred to advanced endoscopy units. Background. Removing LAMS may be difficult and even harmful, but these features have seldom been analyzed. The authors aimed to generate a comprehensive assessment of the feasibility and safety of LAMS retrieval procedures. Methods. This was a prospective multicenter case series including all technically successfully deployed LAMS between January 2019 and January 2020 that underwent endoscopic stent removal. All retrieval-related data were prospectively recorded using standardized telephone questionnaires as part of centralized follow-up that ended after stent removal had been performed. Multivariable logistic regression models assessed the potential risk factors for complex removal. Results. For the 407 LAMS included, removal was attempted in 158 after an indwell time of 56.5 days. The median removal time was 1 to 4 minutes. Removal was labeled as complex in 8.2% of procedures, although advanced endoscopic maneuvers were required in only 1.3% of procedures. Complex removal risk factors were stent embedment, over-the-wire deployment, and longer indwell times. Partial embedment was observed in 8.9%, and complete embedment was observed in 3.2%. The embedment rate during the first 6 weeks was 3.1%, reaching 15.9% during the following 6 weeks. The adverse event rate was 5.1%, including 7 gastrointestinal bleeds, 5 of which were mild and 2 moderate. Conclusions. LAMS removal is a safe procedure, mostly requiring basic endoscopic techniques attainable in conventional endoscopy rooms. Referral to advanced endoscopy units should be considered for stents with known embedment or long indwell times, which may require more technically demanding procedures.